So I want to end just by talking about types of validity in qualitative research, and some of which some of these types of validity are influenced by the way that we design our sample. So descriptive validity refers to accuracy of the data, and it's the same concept as credibility that we've talked about. Basically, is the researcher making things up or distorting things that they saw or they heard? This is the base on which all other forms of validity is built on. And it can include also quantitative descriptions, things like, whether some type of response was frequent or rare, or the number of people in a focus group who shared a particular view. Those are counts, or sometimes known as quasi-statistics, in that they're supposed to help with the description of the data, but they're not used to make any sort of statistical inferences. So to give you an example, there was a study conducted by a Stanford researcher. Her name is Priya Fielding Singh. It was about food consumption, and she used interviews and observation. So in her report of her findings, she wrote about a situation where a child asked their parent to purchase a soda. So a question of descriptive validity would be, did that actually happen? Did she make that up, or was that actually a real event? Now, we don't just want to provide a description of events or behaviors. We also want to explain what these events or these behaviors or these experiences mean to the people who were engaged in them. So this is where interpretive validity comes in, and it refers to how well the researcher reports the participant's own meaning. So this should be really driven by the participant's perspective, right, rather than the researcher's perspective. So continuing with the example, when the parent said yes to the child who asked for a soda, did they do so thinking that sugary beverages are healthy, or was it despite knowing that they're unhealthy? So whether the researcher inferred that correctly would be a question of interpretive validity. Theoretical validity refers to the validity and the coherence of the theoretical concepts that the researcher applies or maybe even develops during the study. So any theory has generally two components. There are the concepts or the themes that the theory uses, and then there's the ways that these concepts are thought to relate to each other. And both of these should be valid. So continuing with our example, the families in the study mostly worked low-wage jobs and struggled to make ends meet. So the researcher labeled the act of buying one's child a sugary beverage as a buffer against deprivation. As a sort of a rare chance to say yes to their children when they have to say no to so many other requests. So, is that a theoretically valid interpretation? What counts as theoretical validity depends on whether there is consensus in the community concerned with the research. So the community in this sense means other researchers usually, or other people who are experts or who study a particular phenomenon. Generalizability is the same as transferability, as we've talked about, and sampling is important here. So we use purposeful or theoretical sampling to target participants or cases that can provide us information that is, sufficiently rich so that we can fully understand a phenomenon and develop theory around it, rather than sampling people so that our sample is statistically representative of the broader population, right? That's the goal of quantitative sampling. So the assumption here is that the theory may help us understand similar people in other contexts. So in the study about food consumption, it was conducted among low-income families in the San Francisco Bay Area. So a question of generalizability would be, do the theoretical interpretations likely apply to low-income families in other areas of the country? Or could the findings help us interpret other objectively unhealthy behaviors? Finally, evaluative validity relates to evaluations and judgments of the researcher themselves. So for example, stating something like, the parent was justified in purchasing the sugary beverage for their child given the broader social and economic circumstances. Or something like, the ways low-wage work forces people to decide between essential things like housing, healthcare, and healthy food is unacceptable. Those are evaluative statements that, again, are deemed more or less valid by others in the research community. And these types of evaluations are very common and they're important in public health research. So that brings us to the end of the qualitative portion of session 11. Thanks very much for listening.